where mental health meets real life. I'm your host, Samantha Ariza, a licensed therapist, former educator, and a semi-normal human being, but really your go-to person for relatable conversations about healing, growth, and overall emotional wellness. Around here, we believe that mental health doesn't have to be stiff or scary. We keep it human, practical, and hey, let's have a little bit fun while we're at it, right? Because life is messy, and we're all just trying to figure it out. Each week, you'll get honest insights, science-backed tools, and stories that remind you you're not alone in this. Whether you're on your own healing journey, supporting someone else, there's something here for you. So take a breath, grab a cup of coffee, just get a little comfy, and let's dive in. So let's get real. I see this take thrown around all the time. Burnout isn't real. It's just laziness. Or its cousin, mental health days are just an excuse to slack off. And I want us to dig in, not for the sake of winning an argument, but to understand why that kind of talk is harmful and what the evidence actually tells us. So in this segment, we'll cover what burnout really is, according to science, why dismissing it as laziness really minimizes serious consequences, how mental health days, as skeptical as people see, often comes from flawed assumptions, and why wellness programs and yoga fixes sometimes feel very performative and really don't solve the problem. And of course, we're going to get to that deeper systemic issue that is driving burnout, not an individual moral failure. And it's something that I'm seeing everywhere. I do a special presentation with Mind Your Mind called Empowering Educators. It's a 2-part series. One is about creating a compassionate climate, and the other one is about sustainable self-care. Each one of these presentations are super important for educators or those in school environments because it puts importance on the educator and helps them try to manage the unmanageable, which when we're talking about burnout and talking about this subject can be super important and be the reason why so many people are feeling burnt out. So I am super happy about talking about this topic. I'm super excited to really kind of dispel all the rumors and really hope that you can pull some stuff from today's episode to really help you understand yourself better and understand why you are feeling this way. So let's get into it. Let's start with definitions and what research has established. Of course, we know that burnout is not laziness. It's a syndrome triggered by chronic, unrelenting stress, especially in the work environment. The core model mostly used in research is the Maslow Burnout Inventory Framework, which identifies 3 different dimensions. And these are the dimensions we're going to talk about when it comes to burnout. The first one is exhaustion. This measure includes physical and mental components. This means people feel overwhelmed by work and depleted of the necessary resources to meet the demands of their job successfully. They feel drained and used up without any source of replenishment and recovery. People will lack enough energy to face another day or another problem. The exhaustion experience can also be described by such terms as depletion, debilitation, fatigue, and the overall feeling of being worn out. But that is only one of those dimensions. The next one we'll get into called cynicism. This dimension of cynicism refers to a negative, callous, or excessively detached response to different aspects of a job. It can develop as a result of overloaded exhaustion and can be self-protective at first by providing an emotional buffer of detached concern. If people are working too hard and doing too much, they'll begin to back off, to cut down, to reduce what they're doing as a way to protect themselves. But the risk is that detachment can result in the loss of idealism. And this whole idea of dehumanization of others who are the ones receiving their work, especially when we're talking about um, careers that involve service. Over time, workers not only create buffers and cut back on their quantity of work, but they also develop negative reactions to their jobs and the people they encounter in them. The cynicism experience is sometimes called depersonalization. Given the nature of working with humans and the human service occupations, they take away their humanity when they feel this way. But other words and phrases used to describe it can include irritability, withdrawal, loss of idealism, compassion fatigue, especially if you work in the human services like a therapist or counselor, you can feel that compassion fatigue, and generally negative and inappropriate attitudes towards clients. As cynicism ramps up, people will shift from trying to do their very best to doing the bare minimum. Inefficiency is the third dimension, and it refers to the feelings of powerlessness and a lack of achievement and productivity in work. Any person, no matter what you do, has a sense of self efficacy in their job, which is defined as their belief in their capacity to do their job well. When they have to deal with insufficient job resources, lack of social supports, or loss of opportunities to develop professionally, their self efficacy suffers. You may also feel that you've made a mistake in your choice of career path, or feel that you're turning into a kind of person that you really dislike. As people develop such negativity towards themselves and sometimes others, they lose more confidence and may sink into depression. Inefficiency has also been called reduced personal accomplishment, incapabilities, incapacity, low morale, and the inability to cope. Burnout is also a continuum. A person may feel cynical and ineffective, but not be exhausted. Or they may be exhausted and cynical, but incredibly effective and impactful. I want to emphasize here that burnout is not a normal thing, even though it is something that happens quite a lot nowadays. But I want to give you the extreme because most people might enter it into small or big ways. We don't really know. So I'm trying to give you the most extreme so that you can compare. A narrative review called Burnout Phenomenon, Neurophysiological Factors, Clinical Features, etc., lays out how prolonged stress affects immune, endocrine, and neurological systems, showing this isn't just in your head. It's affecting your whole body. Another review, Burnout, a review of theory and measurement, underscores that burnout is linked to job demands, lack of resources, and a mismatch between the person and their work environment. One recent empirical study, a study of the psychological mechanisms of job burnout by Frontiers in 2024, looked at 477 employees in Chinese IT firms. They found that poor person job fit. This means the mismatch between what the job demands and what you can deliver, and person organization fit both significantly predicted work pressure, which in turn drove burnout. So, in other words, the environment and expectations are doing the heavy lifting and causing burnout, not moral failure, which is what the whole premise of this hot take is, that it is a personal thing versus a system thing. So, labeling burnout as laziness ignores how burnout develops over time with structural pressures, with biological wear and tear, and with sustained mismatch between the job and the person. If we dismiss burnout as laziness, we risk ignoring very real consequences. So let's look at what the evidence reveals. A meta-analysis published in Frontiers in Psychology, titled The Relationship Between Burnout, Depression, and Anxiety, reviewed dozens of studies to see how burnout correlates with depression and anxiety. It found moderate to strong overlaps. People with high burnout scores often also were experiencing symptoms of depression and anxiety. This suggests that burnout is rarely isolated. It's often woven into other mental health struggles. And we saw this during COVID. During COVID, there was a systematic review and meta analysis that focused on healthcare workers, which bore the brunt of that whole experience, if we have to be honest. And they found that the overall prevalence of burnout was about 52%, with emotional exhaustion at 51% and depersonalization at 52%. That is not a phenomenon of slackers. That is a broad population under stress. I mean, we were all under a lot of stress during that time, but healthcare workers especially. Another study, Burnout in Modern Day Healthcare, Where Are We and How Can We Help?, outlines how the pandemic exacerbated existing burnout trends, particularly because the demand on healthcare workers skyrocketed while support and resources remained limited. And we can see the economic and systemic impact. Burnout doesn't just hurt individuals. In the article titled The Health and Economic Burden of Employees' Burnout to US, researchers estimated that burnout cost in lost productivity, in turnover, and healthcare utilization that amounted to billions per year. So dismissing burnout as laziness is not just wrong. It undermines how we talk about organizational responsibility and the cost of ignoring it. Which brings us to our next hot take. Mental health days are just an excuse to slack off. Let's dig into this claim because I know many have heard it, especially in more traditional work cultures. Why do people doubt mental health days? They assume if someone really needed a break, they'd just buck up. They'd just suck it up and keep going. They also equate mental health days with the idea of shirking and, trying to avoid responsibility. They mistrust subjective distress because if I can't see it, it must not be real. But these assumptions often come from a worldview that only physical ailments count or that motivation is always constant. And we know motivation has its up and downs based on, another episode we did. But what does the research say? A recent 2025 open access paper titled Evaluating the Perceived Effectiveness of Workplace Mental Health Programs explored how the employees view the programs their companies offer. Because we know they're like, oh, let's help burnout. Let's give them XYZ to help, right? So many employees felt that programs lacked real utility. There were superficial workshops, stress webinars, and optional seminars, but that often didn't move the needle, and people were left feeling just as stressed as before. The gap between offering mental health days or wellness benefits and actually meeting people's needs seems to be huge. In Harvard's JAMA-based research summarized in Do Wellness Programs Work?, they found that in many cases, wellness programs yield modest short-term benefits at best and often don't change the long-term behaviors. An article titled Why Workplace Wellbeing Programs Don't Achieve Better Outcomes explained that 68% of surveyed U.S. workers admitted they didn't use the wellness resources offered by their employer, either because they felt stigmatized, didn't believe they helped, or just didn't have time. Which is interesting because when we talk about burnout, the ability to manage your time seems to be the biggest one. And if you have high demands, you can't take the time you need. Another Harvard Business Review piece, What Wellness Programs Don't Do for Workers, critiques how many companies treat mental health like an individual responsibility. You go do the yoga, we'll check the ledger. Rather than fixing the system, it's the system at play, not the person. So when a company offers mental health days, but has unbearable workloads or zero managerial support, that day off might feel like a Band-Aid on a broken bone. But that's exactly why I've created courses like Emotional First Aid for Crisis Moments, because sometimes what we really need isn't just time off. It's a toolkit for what to do when everything feels like too much. The course is practical, trauma-informed, and it's video lessons that walks you through how to ground yourself, regulate your nervous system, and make a plan right in the middle of emotional overwhelm. Whether you're anxious, shut down, or just need some help, I'll teach you simple techniques like box breathing, vagus nerve activation, and crisis scripts. These are things that you can carry with you everywhere. It's fast, it's accessible, and it comes with a workbook, so you're never kept wondering what to do next. You can find that course now at arizainspire.com and be ready for the next time you need some mental health support, because real support starts with real tools. Now let's get back to the episode. So here's a frustrating pattern I see. Work environments get toxic. They have high demands, low autonomy, and unclear expectations. We see people burn out. We see the company say, hey, we care. Here's a yoga class, a meditation app, a stress workshop. And then, of course, we see people feel insulted, ignored, or worse, shamed when it doesn't fix their actual workload. So let's see what research says about this mismatch. There is a study that critiques performative wellness. The article titled, What Wellness Programs Don't Do for Workers, again in Harvard Business Review, points out that wellness programs often fail to address root causes such as workload, culture, or lack of job control. We see in another article, What Do Workplace Wellness Programs Do?, which implemented a randomized trial of wellness incentives among approximately 5,000 employees. They found small health improvements, which is good, but there was no significant effect on medical spending or productivity. In short, we see great optics, limited return, especially for the employees, which is where it counts, right? We see surveys of multiple workness wellness initiatives that was summarized in that article, Workness Wellness Programs May Not Deliver Results. This shows that many programs are underused and don't change behavior if the conditions of work remain unbearable. So even if they add a program, if the workplace conditions continue to remain the same, nothing happens. We can even link back to other burnout research. We see in Burnout, a comprehensive review, this emphasized that to mitigate burnout, you cannot just layer interventions on top. You have to reduce job demands and increase job resources like autonomy and different social supports. So offering wellness snacks or occasional mindfulness sessions, maybe adding some yoga or gym or any of that, without actually reducing the overload, is like giving someone an aspirin for a chronic infection. So how can we rework this narrative? Let's rephrase this hot take, because we want to move forward with something a little more useful, right? So instead of saying burnout isn't real, they're just lazy, how about we do this? How about they're overwhelmed by the demands no one should bear alone? Maybe we can say they're surviving systems built without the human component. Maybe we can say, hey, they're hurting. They need boundaries. They need support, not blame. Instead of maybe saying that mental health days are just excuses, hey, maybe we can say sometimes a person just needs space to deal. And space is part of caring. And instead of, we'll throw yoga at it, we ask, what is the structural stress forcing this? Are hours unreasonable? And is the reporting chain covered in confusion? Maybe we ask for clarity in systems and the ability to say no when things are too much. Maybe we ask, is there genuine psychological safety and autonomy? Because if we reorient the conversation this way, we honor that burnout is a warning sign and it's not a moral failure. It's not an internalized thing. It's something that results from a system that is not being helpful. So that hot take that burnout is laziness sounds convenient. It sounds logical sometimes. But it sounds that way if you don't see the chaos behind the scenes. The science, the lived experience, and the data tells us a whole different story. So healing happens when we stop just dealing with symptoms of distress and we start fixing the environment that causes it. Burnout is a result of the system. It's not the responsibility of the individual. And when we start addressing burnout in that way, if we start addressing the bigger picture of things, if we start allowing boundaries and saying no and prioritizing health and wellness and especially mental health, it sounds like we can do a whole lot more than just throwing these band-aids on it. Can't wait for next week? Here's a sneak peek of the next episode on the Ariza Inspire Podcast. Today, we're tackling a very provocative hot take. I like that word, provocative. Diagnoses do more harm than good. They box people in. And I get why some people feel that way. Labels can feel limiting, reductive, and very permanent. But the other side of that conversation often gets lost. The way that diagnoses help people get care, access to resources, and make sense of what's happening internally.